right, this is Stephanie at Healthcare-Edu. I'm going to show you how to do foot care. We're going to go over our supplies. We have paper towels. You can do foot care on the bed or on the floor. We have 2 washcloths, a hand towel, a regular towel, soap. I've already gotten the bucket of water. Gloves is not mandatory. I'll put gloves on, and lotion. And finally, a nail file. So let's start from the beginning. You hand hygiene, okay? You gather supplies. I'm going to pick up everything. This is why, actually, let me leave this. You gather supplies. Let me get this. Knock, enter, close the privacy curtain, and do your intro. Hi, my name is Stephanie. I'm your nursing assistant for today. I'm here to do your foot care. Is that okay? Yes. Can I see your ID? Sure. All right, thank you so much. I'm just gonna make a clean surface. Now I'm gonna do her foot care in bed, but I will show you how you can do it, sit the person up. Are you close enough? Okay, how you can sit the person up and do it on the floor, all right? So I've made a clean surface here. I'm gonna lay my stuff down. I'm going to go get some water. I'll be right back, all right? So I head out, get some water. For video purposes, I've already put water into this basin. Whenever you get water, you check it twice, okay? So I got the water. I'm gonna check, make sure it's not too hot. All right, I'm also gonna grab my lotion, and I'm going to come in and I'm gonna have the patient check. So I check it. Do you mind checking it with your elbow? It's okay. It's all right. It's all right. No, just check it with your elbow. Yes, there you go. How does that feel? Good. All right. So the patient checks the water with the elbow. And so now I'm going to show you 2 different ways to position the patient. I'm going to put the head of bed up. My bed is locked. Okay. So it is not a glove skill, but I'm gonna put gloves on. I don't know why the state didn't make it a glove skill, but I'm gonna show you 2 different ways. What you can do is that you can, let me put gloves on. You can do it on the bed, which is where I will do it. I will do the foot care on the bed, but you could sit the patient up. And I just want to show you how to sit the patient up. If you decided to sit the patient up, you would put the head of bed up, all right? You would put the side rail down. You would take this arm, reach across, and then take this arm on the knees. Can you put your hand on your side, miss? All right, and on the count of the 3, we're gonna twist you, turn you, and plant your feet on the ground. 1, 2, 3. Okay, and if you wanted to do it like that, you would then take the paper towels or a towel and lay everything on the floor and proceed to do the foot care on the floor. We're going to do it in bed, so I just wanted to show you that. So I'm just going to swing her back up, okay? So there's 2 ways. So she is in bed. What I'm going to do is I'm actually going to just lay a towel. If your patient could not lift up their feet, I would just, you know, ankle is the position, okay? So now I'm going to bend this knee. It's ankle and knee, and I'm going to bend it like so. Just fix the towel underneath. And now I'm going to get the basin, place it here, hold her by her ankle, and your feet's in the basin, okay? Don't fill it up with too much water because you don't want to make a mess here. So now you could bring things closer to you. I have a soapy washcloth and a rinse washcloth. When you look on the paper, of course, we're in Massachusetts, is DNA's HD Headmaster. It says to soak the feet for about 5 to 20 minutes, and the nurse will tell you when to proceed. So I'm gonna pretend a nurse is evaluating me. I soak the feet and now the foot, and now the nurse is telling me to proceed, okay? So now I'm going to water and soap. Okay, and I'm going to clean the feet. So I've cleaned her feet, water and soap. Okay, and you don't have to use it anymore, so it could go right to the hamper. It's in the hamper, and now I'm going to take a towel. This is your rinse washcloth. The first one was a soapy washcloth. All right, the water is nice and warm the way the patient likes it. Okay, I've cleaned, I've rinsed, and now in the hamper. So now what I'm gonna do, hold by the ankle, lift up, place on the towel. I'm gonna put this here so I could dump afterwards. Now you could dry with this towel, but I just brought another hand towel in. It's not wrong. If you see me looking over, my students are actually in class right now. We're doing this video. But when you look at it, the only thing that's bold, it says to make sure you dry in between the toes. You wanna think of a diabetic patient. You don't want them to get that little cut in between their toes. So I'm going to dry, lift up, dry in. I'm gonna make sure I dry in between the toes. Pretty paint color. Always linen roll away from you, all right, in the hamper, and you don't get lotion in between the toes. So before I lotion, I'm going to nail file. So her nails are already done, but I'm gonna file, file, file. You do not use the orange stick with, all right, with foot care. So I'm going to file here. Is your foot dry totally?
Yes.
Make sure it's totally dry. And now I'm gonna put some lotion, and it says to not put lotion in between the toes. So you wanna dry in between the toes is bold, and don't put lotion in between the toes. So do a nice little rub down of some lotion. Get some lotion on her ankle bracelet here. All right, how do you feel, my dear?
Perfect, thank you.
All right, so now to take this, I'm gonna lift up, hold by the ankle. Remember, towel rolls away from you. Roll the towel away from you. And now I'm going to take my gloves off. It has lotion. This is the correct way. Remember, they didn't mandate it, make it a glove skill, but even if a skill is not a glove skill and you use gloves, you won't fail. All right, so my gloves are off. That's how you take it off correctly. And I'm going to do my finishing up steps. Side rails up, bed is at the lowest position and locked. Patient comfort, are you comfortable?
I'm good, thank you.
All right, so I'll leave it like that. There's your call light, you could call me if you need me. Privacy curtain open, and I'm going to take all of my supplies, go put it away. This is water, I'll take my time and do that here. I'm gonna take all of my supplies, put it away. The water I'll dump, clean the basin. I'm going to hand hygiene and done. That's foot care.